of course. And as we close and we approach, final season for our course, it's really just, again, just to reiterate how great it's been to have everyone on board here. I put on my Gritflowness t-shirt, as you can see. So Josh, next year maybe we'll put this on our merch site. Easy to do, great, very comfy shirt. It's Gritflowness. And I'm going to talk to you a little bit. So I'm going to start sharing my screen, okay?
Yep.
You see everything okay?
Yep.
Okay. Okay, how's that look?
Looks good.
Okay, so what the heck is Gritflowness? Gritflowness is a made-up term that I created, and that's why I'm wearing these t-shirts, which you'll be able to get at some point. It's my way of reminding myself how the heck I handle stress. And it's basically how we integrate grit, flow, and mindfulness together to improve stress reduction. And the value of that is each one of us deals with anxiety, every single one of us. And we have to have mechanisms to overcome that anxiety and stress, whether you're at the middle school level, high school, college, medical school, parents, attending. We all deal with stress. Anyone who says they don't deal with stress is stressed. And stress is both helpful in some ways and obviously detrimental in many ways. So Gritflowness is the integration of grit, flow, and mindfulness into stress reduction. This is part of our craziness and what I call the full catastrophe. And you'll hear a little bit about a book called Full Catastrophe Living, which I recommend. And I know we've talked about books on our reading list, but Full Catastrophe Living is basically the Bible of mindfulness that was written by Jon Kabat-Zinn. And you obviously know many people in this collage. It includes some of our faculty, our NPs and PAs, our operating room staff, our clinical and basic science research staffs, our tumor board staffs, and of course, my family. I'm a father of 4 and been married for 21 years. So the full catastrophe is how do you integrate all of this and still stay sane without anxiety or stress or depression. And that's what this is about. So we decided, I'm just going to minimize this so I can see. Dr. Langer and I talk quite a bit about this, and we've actually put this in writing. And how do you use grit, flow, and mindfulness to optimize the neurosurgical experience? And of course, we talk about not just the neurosurgical experience, but general medical experience. And of course, you can apply any of these techniques to anything in life. If you want to be a concert pianist or a Wall Street banker or a doctor, all of these are important techniques. We mentioned a little bit about burnout in the last talk, and neurosurgery burnout and medical burnout is a big problem. We obviously know that neurosurgeons are stressed. We work long hours, we have families, we often miss family functions. Of course, we deal with surgical complications and patient injury or death. And of course, we, with the obstetricians that you just heard from, are in the most litigious disciplines out there. So we tend to get sued as much as our OBGYN colleagues because the complications are significant. So 57% of American neurosurgeons report feeling burnt out, compared with about 40% of surgeons from all specialties. What I found very interesting in the neurosurgical field, and this is true for other fields as well, that you're more likely to be burnt out if you are in a private practice setting as compared to an academic setting. And the rationale for that is simple in that if you have other things besides the rote procedures that you're doing over and over again, if you're motivated by education, research, clinical trials, basic science, you're doing experiments on animals and doing your practice, you may have less burnout rates than the colleagues that, let's say, are doing hernia repair surgery over and over again in a community hospital. So that data is important. And we know that many neurosurgeons, and this is a self-fulfilling prophecy, we tend to attract people into our field who become addicted to their work. And we know that repetition can become tedious and boring. So we need to be able to experiment. We need to be able to have variety, and we need to make research and teaching a part of the job. And the greatest enjoyment comes from these aspects of our job. And you can see that in our department in Lenox Hill Neurosurgery. We have one of the most varied, experimental, non-traditional, non-boring departments anywhere in the country. And we call this the autotelic self. We'll talk a little bit more about the autotelic self shortly. But when we talk about the autotelic self, it's basically, I do something that's so enjoyable, I don't need to get paid for it. The activity itself is so enjoyable. And frankly, as you've heard from Dr. D'Amico and others, we just enjoy the heck out of our job so much that that's what motivates us, okay? And we know that there are lackings in residency training, that we're not really taught how to handle stress. And so dealing with stress is a learned skill like anything else. You have to handle stress by developing muscle memory, and learning the skill of handling stress needs to be part of your training. And so the rationale for Gritflowness is to introduce three concepts, grit, flow, and mindfulness, into your mindset, and to make you aware that you carry these stress reduction techniques with you every single day. And that regardless of whether you're in political uncertainty or social injustice or surgery, that you can handle any stress in life with these three techniques. And of course, improving the mental and physical health of the doctor, guess what? Improves outcomes, improves patient satisfaction, and reduces errors. And we'll talk a little bit about that. All right, let's get down to the nitty gritty. Gritflowness are three stress reducing principles combined into one made up word. And you can make this any way you want. But for me, I couldn't really remember the words all that well. And the concept and the cartoon on the bottom of this slide shows that the arrows are always pointing toward flow. So you want to be in flow in life. And flow is a state of complete concentration that leads to this feeling of effortlessness. Many of you probably have seen the Last Dance documentary. It's the second best docuseries of the year. And in that, you saw Michael Jordan lead the Chicago Bulls to 6 championships, 3 consecutive championships twice. And he would talk about flow in a basketball game, where he would achieve that effortlessness of his shot, where he knew wherever he was on the court, if he was shooting a jump shot, it was going to go in the basket. We want to be in flow as surgeons. We want to be in flow in life. And these are ways to get there. We're going to talk a little bit about grit. Grit, obviously, everyone thinks that you have to have grit. You're born with grit. Grit is a driving force that enables one to commit to a goal. But we're going to talk a little bit about deliberate practice. You can't just walk on a tennis court and play singles tennis with your friends every Saturday and expect to really get better. You're going to maintain a level, but you're not going to get better to where you're a peak performer. We'll talk about why that's the case. And of course, many of you have heard about mindfulness, and mindfulness is the mental state where you're focusing your awareness on the present moment and acknowledging and accepting one's thoughts, feelings, and bodily sensation. Most importantly, bringing your attention back to your breath. So let's talk a little bit about grit. Actually, Angela Duckworth is a professor, psychology professor at the University of Pennsylvania, where I trained. And this book is one of the books that I would recommend you reading It is really shows you how to get to where you want to be, and again, falls on my reading list. I'm going to grab a thing of water. See if I can open this. There we go. Okay, so what is grit? Grit is basically driving force that enables one to commit to a goal and deliberately keep moving in order to accomplish it. Those in medicine and nursing inherently have a strong sense of grit. You would think that 11-year neurosurgery training process, you're going to have to be goal-oriented, and you're going to have great accomplishments that come from a passion and long-term perseverance. So how do we improve one's grit? You basically have to do three things. One is develop an interest early, develop a deliberate practice, and then achieve a purpose. So I'm going to talk to you a little bit about what deliberate practice is. Deliberate practice is the practice of becoming a world-class expert. And those who end up on the curve want to get to the part of the curve, which I'll show here, which is the world-class expert curve. Josh, do you see that well?
Yep.
Okay. So we want to develop over time a skill where we develop as a world-class expert. Remember, I talked to you a little bit about that tennis player. If you keep playing tennis in a singles game every Saturday, you're going to flatten out into this arrested development curve. So over time, you want to continuously have a deliberate practice where you go up on that world-class expert curve, okay? And this is the difference. Of course, if you stop practicing and acquiring skill, you're going to become a dropout, and you're going to have little skill over time. So this is a question that I would ask the group. What's the most important? And I asked this for my kids: talent, effort, or skill? Okay? What do you think the most important thing is? Talent, effort, or skill? Take a moment and think about it. Some people would say, well, talent's the most important. Actually, as you can see from this chart, effort is the most important. So effort is more important than talent or skill. The reason is you may be born with a talent or acquire a talent, but unless you put the effort to get along that curve to peak performance, you'll never develop that skill. Once you get that skill, in order to get up high on that peak performance chart, you have to have improved effort. So talent is how quickly one can improve skills when effort is invested. And of course, each one of us wants to be on that peak performance curve so that we can achieve expert achievement. So how do we make ourselves more gritty? And this is something I taught the residents at 7 o'clock this morning. You must develop an interest in your field early. So choose areas, and I always say this, I say this to my kids too, you're good at what you like and you like what you're good at. So make a choice about what you're going to actively pursue. And of course, we want to be successful neurosurgeons, and that takes deliberate practice. So deliberate practice is hours upon hours in the classroom, the anatomy lab, the tennis court, the violin practice recital area. And many, many people, whether it's Andre Agassi, a former professional tennis player, most people would say that deliberate practice is not fun. I remember when I was at Penn, I would spend hours and hours in the cadaver lab by myself practicing skull-based surgery in a cadaver lab so that I would have that sort of muscle memory of practice. So that's an important thing, is to remember that deliberate practice, unfortunately, whether it's 10,000 hours or not, is not fun, usually. Feedback and mentorship are an extremely important components to grit. Unless you have somebody giving you feedback, and I use the example, I refer to sports a lot. Steph Curry had his dad, Del Curry. You know, most people would say that Mozart was a prodigy, but in actuality, I think, if I don't stand corrected, his parent, one of his parents, his father, was a middle school music teacher. And that feedback and mentorship that even Mozart got at a very young age helped him develop into obviously a peak performer. So make a choice, start the deliberate practice, and make sure you get that feedback. And of course, you want to do something that has purpose. Now, in medicine, it's very nice because we do things, as you heard from the doctors before us, that whether you're delivering babies or whether you're taking out a brain tumor, we are fortunate to have purpose in our field. And so we're constantly reminded of our reason for wanting to accomplish our goals. And that's a very, very important component of grit, is that this is purpose. I'm going to make the world a better place. And there's no field like medicine to give you that sense of purpose. So before I move on to the next book and the next portion, just remember grit is interest, practice, purpose, and that's how you get there. This is another great book called Peak, the Secrets from the New Science of Expertise. It really talks about the science of peak performance. You must develop this deliberate practice to become an expert performer. And what this book talks about, which I think is terrific, that in order to develop that peak performer, the best peak performers are the ones that make expert or efficient mental representation. So I just want to tell you what I do before every surgery with my residents or fellows or staff is I want to mentally represent in my mind, in my brain, what's going to happen when I'm in the middle of this brain tumor. And those mental representations help me to process information quickly, because as you make those mental representations ahead of time, God forbid that situation or difficulty you run into in surgery, you'll have processed that information before. So expert performers have better mental representations. They make faster, more accurate decisions in a given situation. And that's because by doing this mental representation ahead of time, you've actually changed the neural circuitry in your brain. So I want each one of you, whether you're driving a long distance, whether you're practicing for performance, whether you're an actor or an actress on Broadway, the best performers are those that make mental representation. So how do we do this in healthcare? Well, our residency training is actually, we're shifting our design to make it a more effective training regimen, okay? We need to be able to push ourselves out of one's comfort zone. Like I talked about, deliberate practice is generally not enjoyable. Going to the cadaver lab on a Saturday, all day, every Saturday, is generally not as enjoyable as going out to Central Park in New York City on a nice Saturday. You need to set your specific goals, and you need a teacher, a coach, or a parent to provide feedback. And that is where role play is particularly effective. It requires deliberate and full attention. Now, Malcolm Gladwell talks about 10,000 hour rule. You really don't need 10,000 hours. You can have 8,000 hours of deliberate practice and be a peak performer. So it really depends on producing and improving one's mental representations. If you do good mental representations, your brain will adapt and change. And these will lead to physical changes in your body, both in your brain and your muscle memory, to make you a peak performer. Any athlete will tell you that deliberate practice toward professional achievements required deliberate practice with a good teacher or a good coach. This was an interesting study that was done in London that looked at taxi drivers compared to bus drivers who drove the same route in London. Now, I don't really understand the London street grid, but apparently it's very, very complex. So the London taxi drivers had to memorize these very complex street grids. And it was found that when you compared the hippocampi of London taxi drivers compared to the same age, same-sex bus driver who just did the same route every day, the London taxi driver had a bigger hippocampus, suggesting that you can actually improve memory as you age in the adult, which is an extremely important thing to do. And we didn't really think that was possible years ago. So you can actually make improvements in memory and functional instructional changes in your hippocampus, even in adulthood. All right, just to remember, focus, feedback, and then fix it. Make sure you're focusing on deliberate practice. Okay, the next part of our word is flow. Flow we talked a little bit about, and again, this is a terrific book that talks about the utilization of grit and deliberate practice that leads to the flow state, and the optimal experience. We all want to get into the flow state. We all want to be in this optimum place of complete concentration. And many people talk about this. And this is where the state of complete concentration make those in flow feel like they are performing just highly challenging tasks, i.e. surgery, effortlessly. I want to be in flow during surgery. People who are in flow, people always ask me, how do you sit for 8 hours and do a brain surgery? To me, that could be 8 minutes, because if you're in flow, time flies. You're not bored, you're not stressed, you're completing a challenging task effortlessly. We see threats as enjoyable challenges to overcome, and those people who achieve flow have more significant feelings in their lives, and in general, more happiness. How do you achieve flow? Well, the first 2 parts of our word, grit leads to flow. And we try to achieve flow to optimize the neurosurgical experience. In order to be in flow, you must let muscle memory take over. You can't, I always say, I don't like to make decisions on the day of surgery. I try my hardest to make sure all of those mental representations that I've done allow me not to make any decisions. Oh, I'm going to use this new instrument, or I'm changing my microscope, or maybe I'll do this or that. It's really not what you want. You want to be in a flow state where muscle memory is taken over, and you can focus instead on the big picture. I'm going to take this tumor out this way, in this angle, in this approach, and not fall victim to the minutia. Now, getting to flow is basically achieving something called neg entropy. Neg entropy is the opposite of entropy, which is sort of chaos. Neg entropy is the state of inner harmony, when all of the outside stimuli feed into your goal. And you can get into neg entropy with highly disciplined mental activity. And basically, how do you do that? You do it through deliberate practice. Those in flow are able to basically ignore all distractions and stressors and achieve neg entropy. Okay. I'm having a little trouble here. Hold on. Okay. We come back a little bit to the autotelic experience. The autotelic experience is the idea that an activity is not done with the expectation of some future benefit, but because it's just a reward to continue to doing it. It is so enjoyable, I would do it even if I didn't have to. And what I always say is surgeons should try to achieve the state where it becomes autotelic. And most of us who go into neurosurgery really get to this autotelic experience where it's just so pleasurable that we would do it regardless, like I said, if we got paid. All right, so just to bring back a little bit of flow into neurosurgery, we want our residents to set goals, to take ownership and control of their decisions, to become immersed in their activity, develop the ability to focus, pay attention to what is happening, and actually learning to enjoy the experience to be a source of joy. Just to mention another concept called the default mode. Default mode thinking is basically when your mind is wandering, and 50% of our time is spent in the default mode state. And mind wandering, we know, is associated with lower levels of happiness. So you want to kick your mind out of default mode thinking and rumination. We know that self-referential thinking and rumination is not good. We know that catastrophizing, where your mind is just ruminating and thinking, makes your amygdala hot and bothered. Remember, your amygdala is your anxiety center. You want your amygdala to be nice, cool, and calm, not hot and bothered. So we know that meditation, we'll talk a little bit about mindfulness, reduces the amount of time you're spent in default mode. Okay, to my favorite book, my #1 summer reading book, the #1 book you should be reading. It should be at the top of your list. So I'm going to leave this slide up. This book is called Full Catastrophe Living. It's by Jon Kabat-Zinn. It is basically like I said, the Bible of mindfulness-based stress reduction. It is a book that I give to every one of my staff members. I've given it to all my residents, my operating room, my wife, and my nursing staff. I read it every year, and it is just a terrific book. The full catastrophe is that picture that I showed you in the beginning. It's everything in our lives, our families, our friends, our work, etc. And this is the first quote from that book. I've had my moments, and I know if I'd had to do it all over again, I'd have more of them. In fact, I'd try to have nothing else, just moments one after another, instead of living so many years ahead of each day. So essentially, live in each moment. We all have cell phones. My cell phone is going crazy. Practice being mindful. We talk about deliberate practice. We talk about getting in the flow state. Mindfulness training requires deliberate practice. So put your phones away and let's talk a little bit about mindfulness. Now, mindfulness is not doing meditation on a stretcher at work, all right? But it is incorporating, in a way, the practice of being, to tuning into each moment in an effort to remain awake and aware. And we all have, thoughts that come in and out of our head, whether it's our next assignment, our next final, our spouses, or our work stresses. We don't judge our thoughts. We learn to refrain from judging them. And what I like to say, you see it, your thoughts, and let it go. And of course, these are the foundations of mindfulness: not judging, patience, beginner's mind. Basically, cultivate a mindset that it's your first time experiencing something. Obviously, trust, non-striving, acceptance, and letting go. And of course, I'm somewhat rushing through this, but really the power of breathing is the most important concept in my mind for mindfulness. And paying attention to the breath supports ongoing awareness of the present moment. I always say there only is really three things that are with me at all times: my wallet, my phone, and my breathing. Now, sometimes my wallet is not on me, and sometimes hopefully my phone is not on me. So wherever I am, I know that I can always come back to my breathing. And that's what mindfulness really tries to teach you, that at any moment, whether your aneurysm just ruptured, or you just got yelled at, or you're at a traffic light, tuning into your breath brings us into the moment. And it immediately anchors your awareness to your body. And that is an extremely important way to actually cool down your amygdala. And you have it with you at any time. And I'm going to talk about the science of this. So just pay attention, nothing more. Don't push or force breathing. Don't try to control it. Just let it happen. And tuning into your breathing is an effective way to achieve meditative awareness. And it's an effective way to turning into the present. And as you've all seen, and we've done it here, mindful moments are a big part of our operating room experience, where we take a practice of 10 to 30 seconds before every case to just close our eyes and focus on our breathing. And each one of you, every one of us, needs to set aside a period of time each day to do just what this frog is doing: focus on your breathing. If you do it for 2 minutes a day, 5 minutes a day, 10, 30, etc., the science will support that you have a better chance of being less anxious, and your amygdala has a better chance of being cooled down than somebody who doesn't. And if you get thoughts as you're closing your eyes and you're taking 3 deep inhales through the nose and out through the mouth, and thoughts of tomorrow start racing into your head, that's fine. See them and let them go. Come back to your breathing. Okay, here's the science behind it. Okay, and of course we need, Western medicine needs good science to make people do things. But a Harvard study showed that by functional imaging, that people who did 8-week meditation had decreased amygdala activation during their meditation and increased concentrations in their hippocampus, just like those London taxi drivers. Well, isn't that what you want as you age? A cooler amygdala and a bigger hippocampus? Absolutely. In fact, other studies have shown that if you participate in just 3 weeks of training, you can decrease your amygdala activity. And that has been repeated and repeated. Here's an interesting study of football players, I think from the University of Miami, that showed that those who had greater engagement in mindfulness training were protected them from declines in sustained attention, meaning that they were likely to be more attentive, and these were linemen on a football team, than those who did other sorts of training. So in order to achieve mental toughness, attention, do what I just told you. Remember the image of that frog just sitting there on a lily pad, breathing. That's what mindfulness training is, okay? And it basically also will reduce errors. A Japanese transit study showed that conductors who underwent mindfulness training techniques, their rate of mistakes were reduced by 85%. I mean, that's a significant outcome. And particularly for healthcare providers, if you can reduce error rates in our staff, both nurses, doctors, PAs, whatever it is, it's going to be important. And your breath is your path. I just want to remind you, your breath is your path. You can always return to it if you stray off course. It's always with you wherever you are. You can induce a feeling of calm and support. And just remember, each one of you has the ability to do a mindful moment at any point. So in this stressful time of COVID and other stressors, just remember, your breath is your path. Josh, I have this video here. It may not show. I'm actually going to skip it.
Okay.
So David Langer and I have talked a little bit about how to achieve, of course, I'm getting a phone call now from a nurse. How do you achieve flow in this crazy time? And so we've looked at these techniques, and you can see from this this chart that we are trying to get into that middle flow channel. And that middle flow channel is really the autotelic experience. That dotted line is what we call the neg entropy line. And it prevents us from being above the flow channel, which will have anxiety, because essentially our skill does not match the problem. And of course, if you have too much skill for a given problem, you're in that boredom zone, which is below the flow state. And so actually mapping this and using, you can see here, there's, we have a grit line and a mindfulness line that ultimately you want to be in the flow channel. And we incorporated this into what we call the neurosurgery dynamic flow channel. And we adapted this from the flow book that we showed you before. So each one of us at any given point of the day has a certain skill to match a certain challenge. If you have too low a skill and too high a challenge, you're going to be in the anxiety section of this flow channel. If you have too much skill for a given challenge, you know, if you're trained to be an epilepsy doctor and all you're doing are, you know, lumbar microdiscs every day, you may find yourself bored. Not saying lumbar microdiscs are boring, but again, we want to widen that flow channel. We want to never be in the anxiety area. We never want to be in the boredom area. We just want to be in that dynamic flow channel. So as one of my colleagues said to me, grit gets you to flow and mindfulness gets you out of trouble. So in order to get to flow, surgeons must grittily work throughout their careers, starting in high school and college, medical school residency, and finally as attendings. We never stop learning, and we never stop deliberately practicing. I train my residents to study a book that's called Neurosurgical Anatomy, and then I give a lecture every Wednesday to them, and that's my deliberate practice. I'm learning anatomy over and over again, because once you're in flow, problems that arise never threaten that flow channel. You don't want to ever deviate into the anxiety position or, of course, to the boredom position. And this is how one of our colleagues, Mark Simons, sort of put it in this way. Let's say you have a patient with an aneurysm. Okay, so this is sort of a neurosurgical example. Guys like Dr. Langer have to learn the anatomy and techniques involved in operating on complex cerebral aneurysms. Now, David did years of training. He went to Switzerland. He worked in the cadaver lab. And that deliberate practice under the auspices of Gene Flam, another vascular neurosurgeon, David was able to develop the muscle memory to achieve excellence in aneurysm surgery. So what happens during aneurysm surgery? Well, aneurysms can rupture. And the job of a mindful neurosurgeon is not to get what we call catastrophize the situation, where you're basically say, oh my gosh, what's going to happen? The patient's going to lose this amount of blood, and then the patient may die, and then I'm going to get sued, and what's going to be my reputation? And your job is to come back to your breathing, to understand these thoughts, to have the muscle memory, to say, okay, suction, clip, let's go. All right, and it's that sense of calmness that should return you to that flow channel and help bring calmness to the entire operating room. And of course, what does that do? It improves our chances for a good outcome. So we presented some of these ideas to some of our colleagues. And of course, you know, in neurosurgery, these are some of the reviewers' comments, which I find just, I always like showing what happens when our papers or grants are rejected. Anything in red is a negative comment. Anything in blue is a positive comment. In some, most of the reviewers wanted just data. They wanted to show that our combination of Gritflow and mindfulness, there was data points where we can randomize trainees to either our approach versus another approach. And we decided, forget it. We want everyone to get these approaches. So just to give you some of the comments in red, overall, the manuscript will be strengthened by examples of actual data, okay? Blue is they term this unique combination of Gritflow and the paper is timely, so they like it. They think the concept of this report is useful, but their concern is practicality. We think it's very practical. They want us to develop ways, neurosurgical specific ways of developing grit, which we've talked about. How mindfulness is developed in practice. Not clear on how mindfulness helps when one is bored. It'd be useful to briefly discuss how the use of this approach in other fields might be applied to our profession. Well, guess what? This is used on Wall Street, in Fortune 500 companies, in the military, in leadership. This is what everyone is talking about. And this reviewer thought an interesting submission. I really enjoyed the work, et cetera, et cetera. So Ariana Huffington put this on the Huffington Post not too long ago. And you know, all people are looking for help. People are looking for ways to overcome stressors, and particularly in our current situation. So I would encourage you to take what you want and use it, and throw out what you don't want. But just to remind you, with these three stress reduction techniques, grit, flow, and mindfulness, we define a new term to help summarize stress reduction for nurses and doctors and everyone. We hope to improve emotional health, which is significantly intertwined with quality of life for all staff. We hope to decrease stress levels, and we hope to decrease burnout. So we believe that Gritflowness should be practiced at every level of training. And if we want to study this, we need to develop metrics to better study the outcome of these techniques that are utilized, which is what we're doing. But here we are doing a mindful moment, and it has really taken over all of our surgeries. Here you can see Dr. Ellis and Dr. Langer and Donald Frederick, one of our residents. And again, it is an extremely important part of our day. It grounds us. It makes our amygdalas instantaneously cooler, and it helps in our outcomes. So as you've seen before, and I love this quote, sometimes innovation can be looking at an existing treatment in a new light. And for us, at least in Lenox Hill Neurosurgery, we look at things differently. We look at it the next day differently than the day before. And that's one of the beauties of our department. That is David Langer without shoes on, imitating Paul McCartney on the Abbey Road cover of the Beatles. So I think that's the end. And I'll stop sharing so I can field some questions. Okay. All right. Should I field some questions?
Yep, the chat's open if you want to pull it up. The questions for you start at 10:41, and they're coming in fast.
Okie dokie. Wow, I can't even read them. They're moving so quickly.
Just scroll up to the first one, and then it'll stop moving for you.
Okay, here we go. How do you handle self-care when you have a bad experience? Well, I think actually I'm not quite sure what you mean by self-care. I'm interpreting self-care as all of these stress reduction techniques. And one of the most important things we do when we have a bad surgical experience is share our experience with our colleagues. So I'll walk into David's office or Randy's office and say, hey, I got this event or this happened to me, and any thoughts or comments or feedback. And I think that's an extremely important luxury to have, especially in our group, to have that level of support. So, but it requires just making sure that I'm utilizing these stress reduction techniques daily, so I can, adapt to these challenges and move on. Yep.
I think the first question starts 10:41 with, I'm just curious, have you ever considered specializing in psychiatry or having a career in psychology? Do you see that one?
No, I don't. Oh, I'm scrolling up. You want me to scroll down? I don't see that question, but I will answer it. I see mine started 10:42. Anyway, I knew from an early age that in my training, I was either going to do neurology, neurosurgery, or psychiatry, and just because of my love of the brain. So one of the most important decisions you have to make in medical school is, are you a surgeon or not a surgeon? And that to me is probably the most important question. And I knew that I didn't want to be a general medical doctor. I wanted to be a surgeon. And that allowed me to make the decision that psychiatry was probably not the field for me. And hence I chose the field of neurosurgery. But that's an incredibly important point. One of the, people always say, well, how do you decide to be a neurologist or a nephrologist? That decision to me is not as challenging as how do you decide to be a neurologist or a neurosurgeon or a transplant doctor or nephrologist. So that's the decision. Are you going to be a surgeon or not? That's an important decision. Okay. Let's keep going. Do patients only go into the OR if they're having emergency complications? No, they go in for elective, non-emergent. I don't see where my chat.
Are you looking at questions from the previous speaker?
I may be. What time does mine start? 10:42?
I could just read off a few for you if you want.
No, I hear. I'm at 10:42, so. How do you balance life and work and keeping it separate? I don't really separate life and work. People say, how do you keep it separate? I don't believe in separating it. I don't think you can compartmentalize some things, but you have to integrate. I have to be able to come home and share my work with my wife and kids in a way that's meaningful. So you got to balance. Look, I'm home, on Wednesdays, I teach. Obviously with COVID, I'm normally in the lab right now, doing a lab meeting, but with COVID, we do our meetings remotely. I feel like Chris Cuomo in the basement of my house, but obviously compartmentalizing is only a portion of what we do. My kids know that I have to sit in my home office sometime and work. It's not separating them. It's sort of how do you integrate them in a way that's balanced. How do you minimize mind wandering? Well, that's a very good question. You can't force yourself to not be in default mode thinking, which is mind wandering. So what I would say to you is what you can do is start practicing mindfulness. So again, what I told you is most of us spend about 50% of our time in default mode thinking, and default mode thinking is not healthy. It leads to increases in anxiety. And so what I'd rather you do is don't try to minimize mind wandering, but improve your mindfulness breathing training, and that will help you get out of default mode thinking. How did you continue to build grit when you were feeling discouraged? Well, look, I think some of that, we talk about grit, incorporating a mentor and a teacher that's going to provide you feedback. And so we will all feel discouraged. Even as an attending, there are days when David, Randy, and I feel discouraged, but we lean on each other as co-mentors and co-teachers, and that's how we avoid feeling discouraged. If you don't have a mentor or a teacher, I would encourage you to look around and start thinking about, okay, I want to achieve this. Who do I have to reach out to get that kind of mentorship and feedback? That's an important part of deliberate practice. Next question. Lots of doctors believe in strict separation between work and life. Do you try to stop thinking about work when you leave the hospital, or do you believe that's not necessary? I think I answered that question. I don't think it's necessary. I think the important thing is how do you integrate your work in your personal life? Obviously, we did an incredible case yesterday, and my kids always hate when if I ever take pictures, I want to be able to share with them the experiences that we have in the operating room, not to necessarily gross them out if they're grossed out by it, but it's an important part for them to understand what I've been through, what my day-to-day is. And of course, I think from an educational perspective, it's important. Next question. And I'm going to end, Josh, at maybe 10:52 or so, because I have to prepare for an 11 o'clock, if that's okay. Do people in general stay in the flow channel for just a couple of years and then reach boredom or anxiety? And can someone be indefinitely in the flow area? Well, obviously, we're doing this every single minute of every day, right? So how do you stay in that flow channel is really important. And that part of surgery where you in that flow channel, you want to be able to maximize. That's what I always say. You want to widen the flow channel and keep out of the anxiety area. And so again, it's practicing mindfulness, doing deliberate practice of the skill that you're trying to achieve. And if you do that, you don't have to be a surgeon necessarily. If you're even teachers will talk about teaching a subject. If they practice it enough and they get feedback, you can achieve a flow state, even teaching a certain course one day. So we want everyone to widen that flow channel regardless of the situation. Next question, how do you factor in stress reduction techniques in situation in which something must be sacrificed, like exercise, sleep, or social life? Well, look, that's a magic question. I would say that something I've always had a lot of pride in is my efficiencies, right? So you basically, you can ask my wife, like every minute of my day is very efficient. I get up rather early. I wake up without an alarm, really, sometime between 4:30 and 5:30, and most of the time without an alarm. I do exercise 7 days a week, but an exercise can be stretching or meditation. And I don't want you compromising anything. I think all components that you mentioned, exercise, sleep, and social life is important. But look, when I was in medical school, I had to sacrifice my social life a little bit. I couldn't, in order to accomplish the deliberate practice that I wanted, my social life took a hit. So each, day to day, there are some things that are going to be sacrificed. While performing a surgery, say you got stressed out all of a sudden, how would you return to the present moment? Well, I think returning to my breath, like that frog on a lily pad, is the first thing I have to do. And taking a moment just to bring my attention to the breath is extremely important. I would have hoped that I would have formed some mental representations to anticipate some of the issues that would have occurred. So I would have had some of that decision making already constructed in my mind to achieve muscle memory. So again, every case, and I teach all our staff this, is mental representations are an extremely important part of how we go into surgery. What do you think makes a surgeon? How can medical students know if they're suited to that career? That's a difficult question. Is there a certain, je ne sais quoi that makes a surgeon? There's not. You have to have the personality to be. There's an intensity. There's a dexterity that I think either you want to pursue or you don't want to pursue. I do think people who have had experiences in peak performance, whether it's the violinist or pianist or volleyball player or athlete of some sort, have been in those situations where it's a team mentality, but that deliberate practice and that feedback is going to allow them to excel as a surgeon. Next question. What about the stressors of, let's say, a marriage, children, bills, your career? Do breathing exercises and mindfulness go out the window when stress gets too intense? No, just the opposite. The more you practice mindfulness, the more likely you're going to have clear mind when it comes to dealing with the full catastrophe of living. So read the book, Full Catastrophe Living, and you'll understand a little bit about this. So unfortunately, Josh, I'm going to have to end here.
Thank you for coming.
For my 11 o'clock. So I'm sorry if I didn't get your questions, and congratulations on a great year of brain turnship, and good luck on the brain turn final. I'm just kidding. There are no finals.
Don't say that. They'll all think.
I'm just kidding. There's no final.
Don't email me about it.
And then we'll have our Gritflowness t-shirt available. I think it says the integrated state of grit, flow, and mindfulness. Okay, Josh, next year.
Thank you.
All right, thanks, guys. Bye-bye.